Surgeons of Reddit. What was your, oh shit, moment? I was doing a corneal transplant when I had the, oh shit, moment. During surgery, I cut off the patient's own cornea and replace it with a new donor cornea. During that moment when the host cornea was off but before I could get the new one on. There's literally nothing on the front of the eye except a tear film and aqueous humor. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing up everything. The eye is still, open sky, at this time. Everything inside of the eye can now become outside of the eye. And she's bucking and vomiting. Those not in the know will say this is not good. Those really in the know will say, oh shit. Anyway, I had to grab the new cornea and start stitching as fast as I could on a patient actively throwing up. I used 10-0 nylon sutures which are thinner than an eyelash. It turned out okay but not great. Don't lie about eating breakfast before surgery, folks. My bill is a nurse anesthetist. Once, he told me a story about how his day went. He was scheduled to put a little girl, 6-yo, under for some dental type procedure. When they spoke with Dad, things were normal. Typical questions. Has she eaten anything today? No. While the nurse was with the girl getting her ready, she said something offhandedly like, maybe get a special lunch later for being a big girl. Or something else just meant to be supportive. That's when the girl told the nurse that she wasn't hungry because she ate eggs for breakfast. So that was how my bill had that case cancelled for the day. TLDR, your kids are generally honest and they will spill the beans on any lie you tell about them. So just don't do it. Doing a C-section for this poor mum who'd been in labor for hours. Baby wouldn't come out of the hole we'd made. So more pressure was applied to the fundus top of the uterus, and suddenly whoosh. Baby zooms out like a torpedo. Covered in lubricating vernix. Zips over the surgical sheeting which has the texture of a slip-end slide and almost rockets straight off the table. The baby's foot was caught by the reg who whipped her up in the air upside down like in old cartoons. But almost dropped her again due to gloves plus vernix. Thankfully the midwife was ready with the towel and caught the baby to wrap her up. Mom and Dad seemed to think this was normal practice and didn't notice, but me and my colleague just stared at each other with a look of absolute horror. It still makes me shudder to think how close the baby was to hitting the floor head first. Never happened before or since. Doctors were very accommodating and even had a baby juggling routine to put new mothers at ease. 5 stars. Would give birth August. When I was a new RN working the ICU in a large teaching hospital. I came into work one morning to a patient that was admitted that night. Intubated, breathing tube in. Sedated. Foley catheter tube in PP hole, and all. Long story short, he was extubated, breathing tube out that same shift and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work and he needed dialysis. And was only in his late 30s. Said he never made urine anymore and didn't need the Foley catheter, so he wanted it out because it was hurting. Now the catheter bag had been empty my whole shift, which is normal seeing as how he didn't make urine anymore. And this hospital had a nurse-driven Foley removal policy. Meaning while we needed a doctor's order to insert one, we could remove one at our discretion. Unless a doctor specifically put in orders not to. This patient had no such doctor order. So I went to remove the catheter. They are held in the bladder by a balloon on the end that is inflated with 10 milliliters of saline. I de-inflated the balloon, removing 10 milliliters of saline, and pulled it out. As soon as the catheter left his penis, blood started pouring out in a heavy stream. Turns out the nurse who placed it on admission hadn't advanced it far enough, since there was no urine production to indicate correct placement, and had inflated the balloon while still in his urethra, causing trauma. It would not stop bleeding. I had to hold this man's penis shut to put pressure on it while my coworker paged the resident, who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's penis in my hands to staunch the blood flow until urology could get there to assess. It just kept gushing blood every time I eased up to check. For over an hour total I held this man's penis and tried to make polite conversation until the urologist arrived. Not a surgeon, but was working in obstetric theatre in UK mid-heatwave last year. This is important as maternity wards are kept quite warm as newborn babies aren't good at regulating their temperatures. Combine this with a heatwave and the fact that in Britain we're not exactly used to high temperatures and we have the perfect storm. Mid-emergency Kasserine, the scrub nurse assisting the ops, starts feeling faint. This is unusual as this scrub nurse worked in these theaters full-time, so this was her bread and butter. So I can only conclude it was the heat. She has to step out, so the show takes her place assisting the OBS registrar with the section. This show looked extremely junior. As in first section ever. And they were trying to assist with the instruments in the uterus when they fainted. I had to jump in and grab the back of their theater gown to stop them faceplanting the open uterus. And then sort of gently tug backwards to let them fall into me when someone else has taken over assisting. This show was not exactly small. Thank God the baby was already out. This happened to my wife when she was having a planned C-section to deliver our youngest. There were some med students standing and viewing that morning. Real nice kids. We had no problems with them observing. Shortly after things got underway, one of the young men started to look wobbly in the legs. Then fell out, fainted. Took out a rolling tray of instruments, launching it across the room. As he rapidly descended towards inevitable fate of head meeting with cold hard tile. He was promptly carted off. And we never found out what happened to that young man. I only hope that, if he chose to remain in the medical field, his constitution has improved. I work in the OR and have seen some pretty interesting things. First day on the job. The surgeon was doing a lap sleeve gastrectomy. During this procedure, a medical device is used to cut and staple the stomach simultaneously. However, in this case the medical device failed. The stomach was cut open but the staples never engaged, which left the patient with an enormous gash in the stomach. The surgeon ended up finishing this part by hand. I got called into a room to ensure the laparoscopic camera was working and able to record. This was a 6-hour cardiac procedure and was nearing the end, so I knew I was about to see something good. The surgeon pulls out some kind of growth from inside this guy's heart. This thing was the size of a chicken wing. It was growing through his valve and I'm honestly amazed they were alive. Supposedly the only symptoms were shortness of breath. I was not a fan of chicken wings before. But I am even less of a fan now. Thanks, I'm headed over to eye bleach. Surgeon here. I've dealt with loads of morbid stuff, but one thing that made me stop and go, oh shit, was a conversation with a young patient who had a perforated colon from diverticular disease, which is a common wear and tear of the colon. He was one of youngest patients I had seen with this condition and certainly the youngest with a perforation so bad as to require an operation. When I was counseling him on the operation, which involves removing the perforated part of the colon and giving him a colostomy, he told me his biggest concern was how he was going to have anal sex with his same-sex partner. He would only have a small stump of rectum left inside, which would be at risk of perforation with any force applied to it. It made me really think about the implications of the surgery we do. The operation is the easy part. I have Crohn's and I've often wondered about this exact scenario. Is there a way to save enough so that a gay man wouldn't have to give up his sex life? I'm not gay. Just curious. Ba dum TSS. Some people just get really awful luck in terms of their medical problems ruining their sex life. Sometimes your body just hates you. Plenty of female cancer patients get radiation or chemo that scars their vagina and makes sex all but impossible. Male prostate cancer patients can get permanent erectile dysfunction post-op. At least in this case. The guy has a working penis if he wants to be intimate with a partner. Obviously sucks if you like receptive intercourse. But it's not like he can never have sex again. 5th year resident here. There are lots of bad oh shit moments throughout training. Such necrotizing soft tissue infections or take-backs for bad complications or deaths during cases. However, I'd like to share a recent positive, oh shit, moment. 15 centimeters kidney tumor with thrombus into the vena cava. Big incision. Great exposure of the vasculature and the tumor. My attending and I are dancing around the aorta and vena cava. We are able to feel the tumor thrombus in the IVC. I was expecting that we'd need to cut and clamp the vena cava to get all the cancer out. But my attending literally squeezes the tumor out of the vena cava back into the renal vein. And then has me tie the renal vein off so the tumor doesn't slip back into the vena cava. Patient went home in like 4 days. Margins were negative. And is still doing great. First time I felt like, oh shit. I'm a surgeon. Single quote. Not a surgeon. Thought I'd share this though. Husband went in for a routine colonoscopy, and as they were prepping him, anesthetist asks him if he's a ginger. My husband tells him yeah. When he was a kid growing up, he had fire engine red hair, though it's faded to a more strawberry blonde now. The anesthetist laughs and says, "Okay, I gotcha. We'll give you the redhead dosage," and winks. Well, my husband thinks it's a funny, until he wakes up at the tail end of the procedure, pun intended, and doctors are just chatting it up and what have you. Turns out it's not a joke and redheads have some type of natural block to anesthesia. Dude had given him max allowable dosage and he still woke up. Happened a couple years later. They gave him ketamine and some other shit to knock him out to get wisdom teeth out when he told dentist about the colonoscopy thing. He still woke up at the end of that one too. I was the patient. I had a liver transplant and was having an ERCP done to place a new bile duct stent. Well, apparently my anatomy is different than normal, and my lungs go more down my sides. So he accidentally caused a nick, which caused a hemothorax. So when I woke up I couldn't breathe. They did an X-ray and had to do a chest tube. Eventually I was so exhausted I asked to be vented, so he vented me. Apparently he cried, he felt so bad about it all. But it wasn't him being malicious or negligent. It was simply an accident. Happened at my hospital. A mentally ill young woman, who was pregnant at the time, was in denial. Locked herself into her room when she realized the contractions were coming. She basically didn't push and the baby didn't come naturally. Her family called 911 because of the smell. The realized her baby had died inside her and was basically rotting due to the smell. She was taken to the OR to remove the baby, and apparently all the nurses and surgeons were vomiting because once they opened her up the smell was overpowering and it was traumatizing to see a rotting baby. Not me but my uncle. He's a respirologist and was supervising, sitting in on lung surgery to remove a tumor. Turns out the tumor was a root ball. Some type of seed had gotten into the patient's lungs and started to grow. Heard an "oh shit" moment as a patient on the operating table. A couple of years ago I was in labor for 28 hours. Pushing for 6. When my child started showing signs of distress. He had slightly elevated heart rate and I had the makings of a fever. My midwife at the hospital told me the doctor was coming in to check to see if a vacuum assist could help. She checks me and immediately stands up with blood on her hand and says, "We're going to the OR now." At that time, I started feeling that zoomed out tunnel vision I know for me is shock. I had anxiety, but figured she knew what was best. She did. We got in the OR 8 minutes later, and when they opened me up, I heard the surgeon say, "Oh shit, look at this." They say blood in my catheter bag, and upon fully opening me up found my son was actually trying to come through my uterus. He had ruptured it. They got my son out. Those moments where he was stunned and not crying were an eternity. He cried and he was born a completely healthy baby. After I woke up and was back in my room, the doctor came in and told me what happened. I knew a ruptured uterus sounded bad. But oh damn, I googled and started having a massive anxiety attack. A ruptured uterus is extremely rare and so very dangerous and often fatal. I read from the time it happens you have about 15 minutes before you bleed out and baby is dead. When I went back for my post-C-section follow-up, my midwife let me know, as a practice that's been around 35 years with over 30 midwives and doctors, they had never once encountered that, and it was such a big deal for them. A few days after my birth they all got together to discuss my case. I was so incredibly fortunate I chose to labor in hospital. That the doctor just knew from my vitals and babies that something was off. They just didn't know until they got me open. I can't even tell you how grateful I am for Dr. S. You saved my life and my son's life, and our family would forever be grateful.